here is the station. Please. Right. So if you have read and understood, considering it history taking station, kindly please begin.
Okay, good evening. My name is Dr. Daniel Raza, and I'm a surgical doctor. I would like to confirm your name and age, please.
Yeah, good evening. My name is Jack, and I'm 54 years old.
Pleasure to meet you, Mr. Jack. So today I'll
Thank
be
you.
asking a few questions regarding your health. So is that okay?
Yeah, I'm fine with it.
All right. So what has brought you here today?
I'm not able to swallow what I eat. I'm having difficulty in swallowing.
Mm-hmm. I'm so sorry to hear that. Since when you have been experiencing this?
So this I have been for the this thing has been there for the past 10 months.
All right. So did it start suddenly or gradually?
Uh, it it was a bit slow. It was gradual only.
All right. So do you feel any pain while swallowing as well?
Not much.
Okay. So do you feel difficulty with the solid foods, semi-solids, or liquids, or both?
I'm finding difficulty with solids and semi-solids.
All right. So what do you think? What makes it worse and what makes it better?
Oh. When well, solid food, I'm not able to. I'm having little difficulty to swallow. Uh, Something with I'm okay to have some juice or water. I'm easy to drink.
All right. So did you throw up?
Um, no, now I'm having difficulty in both liquids also. I'm not able to. Presently, for
Okay.
recently, I have noticed I'm not able to drink even juice also.
All right. All right. So did you have any vomiting?
Yes,
All right. So was there any blood in that?
occasionally, yes.
All right. So how has your appetite been for the past 10 months?
For the past 10 months, I'm not able to have the food properly.
Okay. So do you experience any weight loss?
Yes, I do. Yes,
All right. And how many kilos?
probably more than uh 8 kilos.
Okay. So do you feel any swelling in your neck?
Yes, I do. I do feel yes.
Okay. So do you feel any bad breath coming out of your mouth?
Yes, I do have that also. Yes,
All right. So do you feel any gurgling voice or wet voice after swallowing?
sometimes yes.
All right. So do you feel any taste of an acid at the back of your throat?
Yeah, I'm noticing that frequently.
All right. So do you feel any weakness in your arms or limbs?
Not exactly, no.
Okay. So do you feel any red eye, dry eyes, or dry mouth?
No, I don't have that.
Okay. So do you see your GP for any other medical conditions?
No, I don't haven't met my GP.
All right. So do you take any medications regularly?
No, I don't take any regular medications.
Or okay, any allergies?
I don't have any allergies.
Okay, great. So is there anyone in your family has been having the same complaint?
I don't think so, no.
All right. So do you mind if I ask you some personal questions?
Yeah, okay, go ahead.
Okay, so what do you do for a living?
I work in a bank
All right, and whom do you live with?
with my wife and kids.
Okay, so do you drink alcohol?
Yes, I do drink alcohol, yes.
And how many units per week?
Um, Probably around 4 to 5.
Okay, and do you smoke?
Yes, I do smoke.
And how many packs per day?
Uh, Not packs exactly. I do 8 to 9 cigarettes per day.
Okay, so what do you think the cause of your complaint is?
I don't know. I'm not sure, but I think it could be because of my age or something. I don't know.
All right, so what are you most concerned about?
I'm I'm concerned. I'm just worried whether it could be anything bigger than no. Yeah,
All right, so and what are you hoping us to do for you?
I would be very happy if you could help me from this.
Okay, so did you have any history of passing out or any blurred vision,
No, I don't remember.
or any chest pain or any shortness of breath?
No, not exactly. No.
Or do you feel any difficulty in passing your pee or poo?
No, I don't have that.
All right, so is there anything you want to add which we have not discussed?
No.
All right. So let me repeat what we have discussed right now. So you have been having difficulty in swallowing foods for the last 10 months, and that has been progressively being difficult with the solid foods, and then now you're facing difficulty with the semi-solids, right?
Yes.
And you have been throwing up,
Okay,
and
good. Thank you. Can you summarize your history now, please?
yes, today I have taken history from a 54 years old gentleman
Yes,
who is alcoholic and a smoker. He
yes.
presented to me with a complaint of difficulty in swallowing foods, and that has been progressive. Initially, he has been experiencing difficulty with solid foods, and now he has been taking semi-solids only. He has lost significant weight and loss of appetite as well. And my patient is a known alcoholic and smoker, and with no family history.
Yes, and he had history of one vomiting as well. Okay, so
Yes, ma'am.
what are your provisional and differential diagnosis for him then?
My provisional diagnosis is esophageal carcinoma,
Okay, and
and differential diagnosis includes uh, the esophagitis, gastroesophageal reflux disease, the pharyngeal pouch, and
okay,
it could be scleroderma
how would
and
you confirm?
achalasia.
How would you confirm your diagnosis?
Yes, for the start, I would like to examine my patient, and that includes a systemic examination, include general physical and abdominal examination, including examination of the lymph nodes. Then I would run the baseline investigations that include full blood count, UCs, LFTs, and cognition profile. I would do the radiological investigations that includes the barium swallow and CT scan abdomen and pelvis with IV and oral contrast to look for any lesions in the esophagus. And I would
Okay,
also consider esophageal manometry.
right. What treatment can you offer this gentleman?
Yes, if based on the current clinical conditions, if the patient is having esophageal mass, so I would discuss this patient in the multidisciplinary team
Good.
to assess and evaluate the current clinical status. And if the
Yes,
mass is resectable, then I will go for the esophagectomy. And if the mass is unresectable and if it is advanced, then I would go for the palliative treatment.
good. Very good. Well in time. Exactly now bell went. Good. Thank you.